Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. If you are Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen. Dermish. All right, Dermish, just give me a little bit of information about yourself, or your practice, what type of patient you see.
So I'm a physical therapist from London, Ontario, Canada, and I have a practice in geriatric care where I provide skilled nursing home physiotherapy in 3 homes. And I have practice in the clinics, in the hospital, in the home health, and I continue to do that. But I learned about Dr. Joseph Jacob through YouTube, and I found it really interesting that it's a holistic approach, and it focuses on not only relieving the physical pain but curing it for a longer time. And I became interested, and that's how I registered for this course. And I myself have experienced today how effective it is in just one session. So I'm looking forward to integrate this practice of ASTR into my own practice, both in geriatric as well as I'm planning to start practice on my own.
Nice. So yeah, thank you. So how many years you've been practicing?
I graduated in 2001, so it's about 18 years now.
18 years. So can you tell me like a little bit background, what manual therapy you've been using personally before ASTR? What kind of manual technique you've been integrating in your treatment?
In the past, I have used manual mobilizations like Maitland mobilization, McKenzie approach,
joint
mobilizations, and all that. Plus, basic strengthening program, fall prevention, and all that. But I have never heard of this kind of advanced soft tissue release, which is done by physiotherapy. So.
Yeah, so we started teaching like that kind of 2 years ago. Yeah, so what would you say to physical therapists after you took the online course and you flew from Canada here to take 1 day hands-on training? So what would you advise therapists about the course and the training?
Yeah, Dr. Jacob has made the online course really well made. It focuses on all parts like bio, social, physical part, and everything. Plus how to integrate nutritional based physical examination, which not many of physiotherapists are aware presently. And I think it's a really important part in seeing patient as a holistic and giving them a long-term relief. Not just you relieve their pain, but they come back after 2 months and they have the same problem. But what I'm thinking is, if we integrate this approach, it is going to give them long-term relief. Plus, I think that's the way to go for it for now.
Yeah. Thank you so much. Thank you.
Thank you.
Thank you.